Hi, I will be explaining the care plan for musculoskeletal disorders and neurological disorders using the E-chart. Okay, so first I'll be explaining for a neurological disorder. In this case, our patient is in vegetative state. So here is the personal data of our patient, how the patient was transported from the ACU to the recovery room, and then how many times the vital signs would be measured. It can be every 30 minutes, every 15 minutes. So you measure the pulse, the respiration rate, the blood pressure, and the consciousness. All of them are noted in intervals. And then after that, the patient will be asked if they feel any pain, and then it'll be noted in intervals again. Any chest pain, any dyspnea, any back pain, and then if they have any respiratory secretion like blood in like hemoptysis, if the cough, if they have any cough, if it has any color, any smell, the rate and the volume, the ascites, and if they have any leg edema, the temperature, the color of the skin, the pulse oximeter, and other normal things that are measured for other patients. And then also the patient may have a tracheostomy, and care for tracheostomy will also be practiced with noting for any hemorrhage, the state of the dressing, if there's any presence of inflammation, vomiting, if there's need for chest drain, urine observations, catheter type, also urine output and liquid output and intake, and then also their feeding, how they're going to feed, and also the pillows that they're going to be supplied to ensure maximum comfort, embolism stockings. The patient in vegetative state is going to also have leg exercises. It can either be passive or active movement. The active movement is the one where the patient is asked themselves to move a part of their leg or try to lift their hands. Passive would be the nursing assistant assisting the patient in doing the movement. If the patient needs any cold or heat applications for the pain, some back rubs, the medication that they'll be given, and also the daily living activities. So, this E-chart is for a patient with a musculoskeletal disorder. In this case, our patient had hip arthroplasty and amputation. The personal data is noted, the weight, how they're transported, if they are conscious, how many times they will be checked, maybe every 30 minutes, every 15 minutes. The vital signs are also monitored, the consciousness, the pain they feel, chest pain, dyspnea, back pain, any respiratory secretions, color and odor of cough if they have a cough, ascites, leg edema, temperature and color of skin, also the pulse oximeter, if the patient has any wheezing or gasping while they're breathing, and if there is any intravenous access either for feeding or for provision of medication. And then at the site of the surgery, we're going to note if there is any hemorrhage, if there's any inflammation, if the dressing state is okay, also if the patient is on a mechanical ventilator, so it's also noted on the chart. If the patient has any tracheostomy, if they have difficulties in breathing, if the patient is vomiting, the drainage loss is also calculated, also the chest drain and the volume of the fluid and color. Also the NG tube, if they have any NG tube, losses will be noted. The wound dressing and the wound drains, as I mentioned before, it'll be monitored from time to time. Also the urine as normal, the color, the concentration, presence of stones, blood, and catheter type, also the volume of the urine, and if the patient has polyuria, anuria, oliguria. And And then also the liquid intake and output would also be monitored as for normal patients. And then also the diet that they take will also be monitored. So since they'll be out of surgery, they'll go from an impure diet to a clear liquid to full liquid to soft to regular diet. And then also the position that the patient will be in, and some pillows for maximum comfort, and some anti-embolism stocks. If they were applied, it will be noted throughout the chart. Some leg exercises, as I said, they will be limited to that bed, so they can either have active or passive movement. Active movement is when the patient is asked to do the movement themselves, and then passive would be the nursing assistant helping the patient to do the movement. Also deep breathing and coughing exercises to prevent any respiratory complications, heat applications and cold applications for any pain, back rubs, medication given, conclusion, re-examination of the patient, dressing change in 1 day, mobility of the patient to prevent any pressure ulcers and to also keep the patient mobile to avoid any stiffness, and also daily living activities of the patient like bathing, toothbrushing, combing, and nail care. Thanks.